Welcome to an update on the Scarborough-East York Service Collaborative. The Scarborough-East York Service Collaborative is part of an initiative called Systems Improvement Through Service Collaboratives, or SISCI for short. SISCI is supported by 6 Ontario ministries and is one of 22 initiatives within Ontario's 10-year mental health and addiction strategy. The Scarborough-East York Service Collaborative is one of 18 service collaboratives across the province. The collaborative is made up of service providers from across sectors such as health, education, social services, justice, housing, and others who have come together with youth and families to improve the system of services for children and youth with mental health and addictions needs in Scarborough and East York. The collaborative was launched in fall 2013 and began by identifying guiding principles and exploring the needs and strengths of the mental health and addiction system in Scarborough and East York. The collaborative identified collaboration and health equity as guiding principles. They identified collaboration as accountability, trust, respect, youth engagement, breaking down silos, and validation of all viewpoints. They defined health equity as consisting of cultural competence, starting where the youth and family are at, doing with the youth and family and not to them, and recognizing system biases. With these principles in mind and the support of collaborative members, the CAMH team spoke to service providers, youth, and families to identify key service gaps in the Scarborough and East York community. Youth input was highly valued in this process. Youth were asked to reimagine systems and services that would best support their mental well-being. They worked with art supplies to build models of their ideas, which were then shared with the service collaborative. Youth envisioned that an ideal mental health and addiction system would include a landscape of supports, a warm welcome, culturally appropriate services, and destigmatizing mental health and addiction services. Discussions with service providers, youth, and family also uncovered that the neighborhood is a key characteristic of Scarborough and East York. Issues related to poor transit, large geographical distances, and safety were suggested as reasons that people in Scarborough and East York tend to seek services in their own neighborhoods. Taking into consideration all of these discussions, the collaborative identified 6 gaps: stigma, awareness of services, wider range of supports, specific services for transitional aged youth, timely access to services, and culturally appropriate services and supports. Next, after examining each gap in more detail and reviewing existing initiatives in the community and youth's visions of a better mental health system, the Service Collaborative decided to focus on how to provide youth and families with timely and accessible mental health and addiction services and supports before they reach crisis. Or, as one youth put it, don't make it seem like you have to be crazy before you can get help. With this focus established, the Service Collaborative now started reviewing potential evidence-based interventions to address the gap. How could Scarborough and East York service providers shift the way that they work to ensure that youth receive services before reaching crisis? Shared care and referral pathways emerged as strong interventions to meet the needs of the Scarborough and East York community. Service Collaborative members now compare these interventions in terms of community capacity and readiness to implement, how well they address the identified gap, and the evidence supporting each intervention. It became clear that the collaborative members envisioned a hybrid model incorporating elements of shared care and referral pathways. Collaborative members imagined the ideal intervention offering culturally appropriate supports, a warm welcome, interim services, destigmatizing mental health services, a warm transfer to broader supports, and neighborhood-based services. With these elements in mind, the Service Collaborative Implementation Team, or SCIT, a smaller working group comprised of Service Collaborative members, got to work. Over the summer months, the SCIT developed the idea of a walk-in model. The SCIT is proposing neighborhood-based walk-in clinics, which would provide counseling, as well as referral and triage to broader community supports. The SCIT then brought the idea of the walk-in clinic to the youth advisory group. Overall, the youth liked the idea, and they provided valuable feedback on elements of this model, including the ideal location, ideal hours, whether they would feel comfortable using the service, and what kind of counselor they'd feel comfortable talking to. In addition to getting feedback from youth, the CAMH team conducted an evidence review to learn more about efficacy and best practices of walk-in clinics and how to make services accessible for ethnocultural and marginalized youth. The CAMH team also set out to learn about the approaches, best practices, and lessons learned of existing walk-in models. The Scarborough-East York Service Collaborative met on September 25, 2014. SCIP members presented this video and their proposal of a walk-in model to Service Collaborative members. We are happy to report that there was widespread interest in this model, and members are enthusiastic about moving forward with this approach.